Welcome to Menopause and You Chat with a Physician. I am Dr. Beverly Vaughn, a gynecologist at Lankenau Medical Center. Today I am pleased to have with us Dr. Lynn Wang as our guest. Dr. Wang is a board-certified gynecologist and sexual health counselor. She sees patients throughout the mainline health system. Today she will be speaking with us about painful intercourse. Dr. Wang, thank you for being here to share your expertise with us.
Thank you for having me.
The first question I want to ask you is, how common is painful intercourse? I think it is something that is more common than we might know.
Yes, absolutely. The range is around 20 to 40%, and for postmenopausal women, they tend to be on those higher ranges. So it tends to be around 1 out of 3 postmenopausal women that experience painful intercourse.
I know that there are a number of causes that can be identified. Could you enumerate some of those for us, please?
The 4 most common reasons that I tend to see in my office are vaginal infections, vaginal dryness, something called Vulvodynia, and Vaginismus.
If you could go through each one of those, because I think some may be familiar to our audience and some may not. So if you could talk about vaginitis to start.
Sure. So vaginitis is just a fancy way of saying vaginal infections. And many women know that they're caused by things like bacterial or yeast infections or sexually transmitted diseases. And a lot of women describe it as having a discharge. They may have an itch or an odor, but a lot of women actually are not aware that they have a discharge. And so for that reason alone, it's very important to see a healthcare provider if you're having painful intercourse. Treatment for that would involve antibiotics. And the thing that I tell women to do is, while they're on the antibiotics, to hold on intercourse for that moment while they're on the antibiotics. The reason being is, if you can imagine, if your skin were infected, it'd be inflamed and irritated. If you were to sit there and rub your skin during that time of healing, it may take longer to heal. So it's really important to rest your body at that moment.
The other things you talked about, you had mentioned vulvodynia. I don't know that our audience is familiar with that term.
So vulvodynia is just a fancy way of saying vulvar pain. And the causes of it we're not entirely sure of, but some theories are from chronic infections or chronic inflammation. And what a lot of women tell me who have vulvodynia, they say, I have a burning feeling on the outer area, and it is sometimes sharp, sometimes feeling like glass. Often this burning feeling or pain gets worse with touch or wearing tight clothing.
If a woman has those complaints that make you think of vulvodynia, who should evaluate that and what treatment can be offered?
Vulvodynia is one of those entities that it's hard to evaluate and treat. And so I would definitely start with a gynecologist, and the gynecologist may recommend certain types of creams and ointments, such as lidocaine ointment or things like Elavil cream. And if that's not working, then the next place to go would be somebody like a urogynecologist or a sexual medicine specialist. And so what I tell women about vulvodynia is that because we don't understand it as well, it's one of those things where sometimes we just have to try different types of medications, because different women respond differently to different medications. So again, there has to be a lot of patience involved on both the patient and the healthcare provider.
So it's not a cookie cutter type of therapy. You really do individualize it to the particular woman.
Absolutely.
I know in my practice I see a lot of older women, and what I hear very often is the concern about vaginal dryness.
Yes. So for postmenopausal women, that is extremely common, ranging anywhere between 40 to 80% of postmenopausal women. And the dryness is related to our estrogen levels. What happens with menopause is our estrogen levels begin to drop down, and when that estrogen level begins to drop down, our vaginal lining becomes thinned out and dry. That dryness can then cause decreased lubrication and then can cause painful intercourse. Once a woman has painful intercourse, she would have less desire to have intercourse, which would then lead to more dryness, and then there is a vicious cycle that ensues.
What are some of the treatments for vaginal dryness, and as well, what evaluation do you do in your practice?
I would start with a speculum exam and examine the women's vaginal lining to get a sense of how severe the dryness is. Once we get an idea of that, then we offer her things ranging from non-hormonal options to hormonal options. There are many different types of moisturizers and lubricants, and the number one question that women ask me is, what's the difference between a moisturizer and a lubricant? And so I tell them that a moisturizer is just used for moisturizing your vagina. It is a water-based cream that women insert into their vagina, and they can do that every day or several times a week if they want. And it's the same idea of why we use lotions every day on our skin. The moisturizer in our vagina would help moisturize that area. Lubricants, however, are usually water-based or silicone-based creams or gels that are used for intercourse only.
And these can be purchased over the counter, or are they prescription only?
They are over the counter.
And what about the hormonal options you had mentioned?
Hormonal options, the main one is vaginal estrogens, which are usually prescribed in many forms. There are vaginal creams, vaginal tablets, rings that women put inside their vagina. And then there are hormonal options that they take by mouth. However, we know that the hormones that you take by mouth, while they may help the symptoms of hot flashes, they may not help the symptoms of vaginal dryness as much. And there is a new FDA-approved drug for vaginal dryness related to painful intercourse. And that is a drug that acts, that is not an estrogen, but it acts like an estrogen in some tissue and an anti-estrogen in other tissue.
Is it a pill? Is it a cream?
It's a pill, and so it may be the right drug for a woman who can't or doesn't want to take estrogen.
When you're talking to patients about using estrogen locally, what are the differences between local use and what we call systemic use, or using something by mouth?
I explain it as vaginal estrogens are not found to have an increased risk of cardiovascular risks, breast cancer, strokes, all of those things that hormone replacement therapy by mouth is connected to. And so women will say, well, does any of it get in my blood? And the truth is that yes, a little bit does, especially in the beginning, because if you can imagine, in the beginning your vaginal lining is very thin and may have small cracks in it. And so as you put that vaginal cream in the very beginning, some may get absorbed in your body, and I have had some women say, I've had breast tenderness. And I say, good, because that means it's working, it's strengthening that lining. But what will happen with time is those symptoms should get better as your lining gets thicker.
Let's move on a little bit to vaginismus.
Vaginismus is a fancy way of saying vaginal spasms. And that is something that is pretty common in women with painful intercourse. A lot of women describe it as feeling like there's a wall in there when they're trying to have intercourse, or some women say that they feel like it's tight down there. And the reasons for having vaginismus are many, ranging from biological issues like having gynecologic surgeries or chronic infections, to psychological issues like a history of depression or anxiety, trauma and abuse, or even being raised with a sex-negative upbringing. On top of that, things like relational issues. If you're having marital discord, that can affect that. And a lot of women say, okay, but then why is this happening to me? And I tell them it's because your body's trying to protect yourself. In other words, your vaginal muscles are tightening to prevent any sort of pain from happening again. A lot of women then say, well, why can't I just relax? And what I tell women is, imagine if you're getting punched in the shoulder multiple times, right? And so with time, what's going to happen is you're going to start to flinch. And that's what your vaginal muscles are doing, is they're tightening, they're flinching. But if you continue to flinch, then with time, you'll also develop a muscle spasm within the muscle. And so you can tell yourself to stop flinching to some degree, but you can't tell that muscle, that knot, to go away on its own. And that's why it's really important to get the proper evaluation and the proper treatment, which many times involves some form of pelvic floor rehabilitation.
So what exactly is pelvic floor rehabilitation?
It's a lot like physical therapy, because it is physical therapy. And what they do is they work on that flinch reflex, but then they also use trigger point therapy, which is basically gently pressing on that knot to let it loosen up. A lot of women with vaginismus, because they're in such a chronically tight position, actually have weak muscles. And so part of pelvic floor rehabilitation will be to strengthen that muscle. And that can be done through pelvic floor physical therapists or sexual medicine specialists, depending on the women's needs.
So they have to see somebody who is expert in that area.
It's helpful. It is helpful.
It seems that there are a multiplicity of factors that can go into why someone would have painful intercourse. Are there other things that might contribute as well?
Absolutely. There are things that have nothing to do with gynecologic issues, such as irritable bowel syndrome, even effects of breast cancer and its therapy. Even though it's life-saving, it may have certain side effects that affect women sexually. The approach for painful intercourse has evolved with time, where instead of trying to fix either the biological issues or the psychological issues, we now try to approach the women as a whole person. And then we also encourage couples to be both emotionally and physically connected, because for many couples, that's what it's all about.
It's a multidisciplinary approach. That's one of the things that I'm taking away from this conversation.
Yes.
The other thing that I think is important is for women to tell their healthcare provider that this is a concern of theirs. Would you agree with that?
Absolutely. Absolutely. It's important to bring it up, especially if it bothers you, because there is treatment out there and there is hope.
Dr. Wang, thank you for being here. That is a very thorough discussion that you gave on a topic that's very personal and also very complicated.
Oh, you're welcome. It's a pleasure being here.